Now we're going to do the lumbar plexus, which includes the obturator and the femoral nerve. And as I mentioned in the last tape, we're going to extend the hip for that. When the nerves go to the anterior of the hip joint, the lumbar plexus, we want to keep the lumbar spine flexed while we're doing that. This lengthens the nerve as well. Now, in order to keep the lumbar spine flexed as we flex the opposite hip, she's going to hang on to that hip, so that's going to keep the lumbar spine flexed. I'll get you to help me here in a chat. And just drop this leg down. Just drop this down. Okay, now lumbar, femoral nerve, lumbar plexus. Now again, I'm going to do some long axis traction and extend the hip. Pressure on, pressure off. Pressure on, pressure off. Pressure on, pressure off. Obturator nerve, similar. Come over a little bit more. And just drop this. All right. Pressure on, pressure off. Pressure on, pressure off. Now, nerves in the lumbar plexus and lumbosacral plexus are quite long, and they run along the muscle groups, which are quite long as well. If the muscle's too tight, then we can't stretch the nerve. We have to lengthen the muscle before we stretch the nerve. And the tip-off to this, if this is what's going on, is when we stretch the nerve, we can't seem to reproduce the pain. The patient feels a stretch in the muscle belly somewhere, but not at the point where we want to target the pain. So in that case, we'll have to do a muscle lengthening procedure. The one I use is post-isometric relaxation. That's where they contract against you a little bit, and then they relax, and we get the muscle to lengthen. So in this particular case, I'm going to demonstrate that. Now when I ask, I want you to push into me very gently. Okay, push in. Oh, way too hard. Just relax. Okay, and relax. Push in again, and relax. Perfect. Push in again, and relax. And as that muscle lengthens, the stretch they'll feel will move from the belly of the muscle more towards the target area we have in mind. Quite often with the obturator nerve, we're looking at the inside of the knee. So I'm stretching the nerve to begin with. They feel in the adductors, but as the muscles relax, they start to feel the stretch in the inside of the knee. Then I've targeted the part of the nerve I want to stretch. Obturator nerve.